Today on BNC Health Watch, vaccines for the coronavirus finally available, but hospitalizations continue to break records. Plus, Chicago schools set to reopen in-person classes, but many teachers are worried that it's too soon to bring children back to their desks. And New York Governor Andrew Cuomo addresses racial disparity in who is getting the COVID vaccine first. Right now on BNC Health Watch. Hello and welcome to BNC Health Watch. I'm Brittany Jones. We've got a lot of health news to catch you up on, but today things are looking up. More than 4.2 million people in the U.S. have received their first doses of the COVID-19 vaccine, but that's short of the 20 million vaccinations the federal government repeatedly promised to have delivered by December of 2020. Some experts say the United States needs to speed up the COVID-19 vaccination process. Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, told NBC's Meet the Press that the U.S. needs to pick up some momentum and get back to where we want to be. Right now, vaccines are being given to healthcare employees and long-term care patients, but officials are hoping to soon have them available to a wider group of the general public. Some states are seeing post-holiday surges, including California, where more than 45,000 new cases were confirmed Sunday. The Centers for Disease Control and Prevention says U.S. health officials have administered only about 30% of the COVID-19 vaccines distributed. The data tracks the 15.4 million doses of Pfizer, BioNTech, and Moderna's vaccines. According to the CDC, only South Dakota, North Dakota, Tennessee, and Connecticut have given out more than half of their delivered doses. Arizona is disputing the CDC data that puts it on a list of states administering fewer than 25% of their vaccines. Officials there say they've given out 28%. The CDC figures were last updated on Monday. Healthcare providers may report doses up to 72 hours after administration. Hospitals aren't seeing any relief. The U.S. has once again hit a record number of current COVID-19 hospitalizations. This week, more than 128,000 people are hospitalized with the virus. That's according to the COVID Tracking Project. That beats the previous record set on Sunday when there were more than 125,000 coronavirus hospitalized patients. It's also the 34th consecutive day that more than 100,000 people are in the hospital with the virus. The U.S. has now surpassed 350,000 COVID-19 deaths. Johns Hopkins University reported 2,398 new deaths earlier this week. The U.S. has reported more than 20.5 million cases. The CDC says more than 4 million people in the U.S. have received doses of a COVID-19 vaccine. The CDC says more than 13 million doses have been distributed. For the first time since the coronavirus pandemic began in March, teachers are returning to classrooms in Chicago, but the move is being met with plenty of opposition. Eric Cox has the story. The FDA is meeting this week to consider giving half doses of Moderna's COVID-19 vaccine to people ages 18 to 55. The head of Operation Warp Speed says clinical data shows the vaccine can be just as effective at half doses in that age group. The move could make the vaccine available to twice as many people under age 55. The Trump administration had the original goal of vaccinating 20 million Americans by the end of 2020. So far to date, only 4 million Americans have received their first of the 2 COVID shots required. Well, you are seeing the first person in the UK, an 82-year-old man, received the Oxford AstraZeneca vaccine. And Brian Pinker says he didn't feel a thing. He says the vaccine is, quote, the only way to get back to normal life. And he says that being vaccinated was a no-brainer. This puts another weapon in the arsenal of healthcare workers facing a serious spike in COVID-19 cases in the UK. Despite the alarming figures, President Trump is calling the number of cases and deaths in the U.S., quote, exaggerated. Trump tweeted, the number of cases and deaths of the China virus is far exaggerated in the United States because of the CDC's ridiculous method of determination compared to other countries, many of whom report purposely, very inaccurately, and low. When in doubt, call it COVID fake news. A woman who lost loved ones to COVID-19 is responding to Trump's tweet. Here's what she had to say.
How could it be fake news? He took my dad, he took my uncle. He has taken so many lives. I don't think it could be fake. It's horrible. It's an insult to me. It's an insult to every family.
Former longtime CNN host Larry King is hospitalized with COVID-19. A source close to his family says he's been at Cedars-Sinai Medical Center in Los Angeles for more than a week. King has had multiple heart attacks and he underwent quintuple bypass surgery in 1987. He's also 87 years old, meaning he's at a higher risk for complications from COVID-19. He hosted Larry King Live for more than 25 years. More than 85 million, that is the number of COVID-19 cases worldwide. Dr. Anthony Fauci says the pandemic could likely get worse in the coming weeks. We spoke with our BNC chief medical editor, Dr. Corey Hebert, about California. That state is seeing a huge spike in cases. The governor has now confirmed more cases of the newer, more contagious UK variant of the virus. Take a listen.
So basically, we have known about this strain since September, and I actually spoke about it on Black News Channel back then. It's just that now, as we start to see the mutation, we start to see that it being more contagious because of the spike protein. Okay, so we can get into the weeds on the science, but what I need you to understand as our viewers is that we have to remember that we have to do a few things. We must wash up, mask up, and we have to separate and vaccinate. We are having a rollout across this country with the vaccine, and it is in a disastrous way because we're letting the states decide how to do it, and the states just don't have the infrastructure set up to be able to do this thing. It needs to be a national program, and hopefully with the new administration, we'll be able to have a national vaccine program. But until that happens, we are going to have to do the things that got us to the place where, especially California, where the numbers were very low. We have to continue to keep our distance. How do we get the curve to be somewhat flattened? We never got to where we were down to 20,000 or 15,000 cases a day. That's what we really wanted to be when we were talking about flattening the curve, so that we wouldn't overburden the system and overburden our medical personnel. But right now in California and some of the other bigger states, we are overburdened. I mean, the ICU beds are full. So we may have to take a step back and say, let's go back to what got us to a better place, not the best place, but a better place, so that we don't have a lot more death. Because we know, even though this new strain is not more virulent, meaning it's not more aggressive, it is more contagious. So just by using statistics alone, we know that if we have more contagious strain, that means we're going to have more cases. More cases means more admissions, ICU. More ICU means more death. So we do not need any more people dying in this country, so we may have to take a step back and start doing the things that we used to do, like shutting things down.
And a somber statistic, listen to this, someone died of COVID-19 in the U.S. once every 33 seconds over the past week. That's 33 seconds, y'all. That's according to a CNN analysis of Johns Hopkins University data. More than 18,000 deaths were reported from December 28th to January 3rd, an average of more than 2,600 deaths per day. The month of December was the nation's deadliest month of the pandemic. Doses of the COVID vaccine finally making the rounds. After the break, we hear from the first nurse to receive her second dose. Plus, discussion continues on who gets the vaccine first. When we return, a word from New York's governor on addressing racial disparities in vaccine distribution. BNC Health Watch will be right back. Welcome back. A New York City intensive care unit nurse who became the first person in the United States to receive a coronavirus vaccine received her second and final dose of the Pfizer-BioNTech COVID-19 vaccine. Sandra Lindsay, who has treated some of the sickest COVID-19 patients for months, she was inoculated at the Long Island Jewish Medical Center in the New York City borough of Queens. That area was an early epicenter of the country's coronavirus outbreak.
I feel like I've completed kind of the marathon. I've closed the loop. I know that we're not out of the woods yet. We don't have that herd immunity yet, but the burden feels definitely much lighter today. And just letting people know that the vaccine is safe, while also not dismissing people's hesitancy and fears, but to use the opportunity to educate them, share my experiences, and just clarify any misconceptions that people may have.
And Lindsay made history when she received her first dose of the Pfizer-BioNTech COVID-19 vaccine on December 14th. The vaccine received emergency use approval from federal regulators on December 11th after it was found to be at least 95% effective in preventing illness in a large clinical trial. Well, as you're aware, the Pfizer and Moderna vaccines are now being rolled out across the country, but some places are running into issues. There is still some fears about the vaccines and their side effects. Those fears especially relevant in the Black community. You just heard from Sandra Lindsay. She says she wants to let people know the vaccine is safe and that she's using her experience to educate others. Dr. Kevin Sneed, the University of South Florida's founding dean at the College of Pharmacy, says much of what health officials have already seen is to be expected.
During the clinical trials for both the Moderna and the Pfizer product, we anticipated that by the time people got to the second injection, a large number of people, probably about 50% of people or more, would have fatigue. We've been expecting some people to have fever and headache. During the clinical trials, it was noted in both trials that we had about 8 people total that experienced Bell's palsy. But we have to keep in mind that the prevalence of that happening during the clinical trial does not exceed what we expect to happen in the general public anyway, even without receiving a vaccine. People going and getting a dental procedure, a root canal, some of them may be susceptible to getting Bell's palsy. And so it's really difficult to ascertain whether or not it really was due to the vaccination or by chance. Now, for other people, the fainting and some of the anaphylactic reactions that are occurring, we knew that some of that may occur, and the most important thing is to have supportive measures in place when people do experience that.
Equality and fairness, that is the goal for distribution of COVID-19 vaccines in New York. To prove it, the governor is taking action. Ashley Lyotis has the details.
On Monday, more people in the state of New York are able to get the COVID-19 vaccine. Now, all healthcare workers who have direct contact with patients, not just those in hospitals, are eligible. Distribution is still in phase 1, but until it is widespread, Governor Andrew Cuomo says he will not take the vaccine.
I am committed to social and racial justice in the distribution of this vaccine. It will be available as fairly and as quickly as we can make it happen. Race or income will not determine who lives and who dies. And I mean it. And that's why I say to you today that I want to take the vaccine. I move around a lot and come into contact with many people, and I would feel much safer if I took the vaccine. But I will not take the vaccine until the vaccine is available for my group in Black, Hispanic, and poor communities around the state.
In his virtual remarks to the Abyssinian Baptist Church, Governor Cuomo said the state is preparing a massive vaccination program. This includes portable units acting as pop-up vaccination sites. They'll be brought to churches and community centers across the state. Above all, health officials are focusing on making distribution fair.
COVID exposed many existing injustices in our society. Testing for COVID was more available in richer, whiter communities, and the infection rate was higher in Black, Hispanic, and poor communities. This can't happen again, and it can't happen with this vaccine. Until the vaccine is available in the South Bronx and the east side of Buffalo and Wyandanch and South Jamaica and Edgerton and East Utica, our healthcare deserts, our job is not done.
Reporting from New York City, I'm Ashley Lyotis for BNC.
And Governor Cuomo says distribution at some hospitals is going slower than expected, and he is calling on those facilities to move faster. Well, still to come, as COVID vaccines roll out slower than expected, hospitals in California are being overwhelmed. We'll have details after the break. California Governor Gavin Newsom announced that 6 people in the state have tested positive for the new strain of COVID-19 that is believed to be more contagious. Meanwhile, in Los Angeles, one patient is sharing his experience as he battles back from the virus. Anita Bennett has his story.
I across Los Angeles County and BNC.
And it is serious, folks. Well, health officials in the LA area are concerned they'll see another surge in COVID cases over the next week, stemming from Christmas and New Year's gatherings. Distilleries face government fines for helping to make hand sanitizer during the pandemic. When we return, good news for those companies, though, who rose to the occasion when they were needed. Welcome back. Distilleries that switched to making hand sanitizer in 2020 received some good news on New Year's Eve. The government rescinded a $15,000 fee it originally charged the distilleries. The Department of Health and Human Services says the fee was charged by mistake. Hundreds of businesses started making sanitizers after supplies of the important product dwindled in March. To do so, they had to register as drug makers and pay a fee to the government every year. But HHS says these businesses should be applauded for their actions, not taxed. A recent study is taking a closer look at teens and marijuana use. The study was published last month in JAMA Network Open. Researchers analyzed data from the 2017 National Youth Risk Behavior Survey. They found that more than 45% of teens reported having used marijuana in their lifetime, and almost half of the teens who smoked marijuana reported driving after using it. According to researchers, the teens were either 12 years old or older. Researchers say the percentage of teens who drove under the influence of marijuana was more than double those who drove after drinking alcohol. More than 300 million people, that's how many people flew in 2020. However, about half of those travelers flew during the first 3 months of the year before the coronavirus pandemic set in. It's a 61% drop from 2019, but still, it's a good chunk of people considering months of public health guidance to not travel. The new tally comes on the heels of a pandemic air travel record set on Sunday. Well, that's going to do it for BNC Health Watch. I'm Brittany Jones. Thanks for watching. Until next time, stay healthy, stay safe, and you take care.
Started with